Ladies and gentlemen, I am the Reverend James Mbogwa, your lecturer for psychopathology. I would want to start by saying I am very sorry because we have not had opportunity to meet for this class. But between now and the exam, I will try to make all the efforts to see that we learn as much as possible. I want to kick off immediately on this unit, psychopathology, by starting on the introduction. Pathology is the study of causes of diseases, and psychopathology is the study of the cause of mental illnesses and diseases. In mental illness, the causes are multifactorial. These multifactors has three levels. The psychodynamic level, that is psychoanalysis and the works of Sigmund Freud, developmental theories of Margaret Mara and Anne Freud, and early childhood attachment theories. If we go back to the psychodynamic theories, we may get some understanding of the causes of mental illness. We have behavioral theory as the second level. The theory here states that behaviors are learned and can therefore be unlearned. There are times that even with learning, we cannot learn more due to having reached the critical level. A critical period must first be reached before further learning can be gained. At the third level, we have the biological levels or the theories, and this is the instance in which chemicals in the brain like dopamine, serotonin, adrenaline, or norepinephrine, for example, helps in the transmission from one nerve to the next in the neurotransmitter chain. At the endocrinal factor or level, we find hormones here can lead to mental illnesses. For example, any effect at the pituitary glands, like the gonads, the ovaries, the testes, all these can work together or singularly to cause issues in our mental health. All factors, therefore, must be examined in psychopathology, and we need to come up with the causative factors while being careful of the predominant factors. And therefore, ladies and gentlemen, I want to look at abnormality, which basically is the other word for psychopathology, or abnormal psychology, which also describe the other word for psychopathology. Abnormality can be understood from the following criteria. Number one, norm violation. Every society has a set of rules that form the basis for deciding what is right or wrong, where, when, and with whom to do what. For example, when, where, and what, and with whom to eat with, when and whom to marry. Norms vary across cultures, and therefore they are a weak basis of labeling one as abnormal. Because the argument here is, if somebody has gone beyond the norm, then you find that at times this person is classified as abnormal. Number two, statistical distribution. Statistically, abnormality reflects any substantial deviation from statistically calculated average. Individuals whose behavior deviates from the majority are regarded as abnormal. It may apply in some evaluation of psychological abnormality. The concept of mental retardation tends to reflect this criterion because those who are considered mentally retarded score below average in intelligence tests. In this context, the very intelligent or geniuses may be considered abnormal. And probably we go back to our unit in statistics, the normal curve. The normal curve presupposes that those who are falling within the normal age in the middle are part of the normal population. So on one side, we have those probably not scoring or scoring below the normal age, and those scoring above the normal age. In psychology or in psychopathology, there is a tendency to classify those outside the normal age as abnormal. And the question is, the highly intelligent, are they normal? This is probably food for thought for you as class members to ponder and come up with your own assessment or your own argument toward this. But in psychopathology, the normal is usually those falling within the normal age. Unfortunately, this criterion ignores values, for example, the desirable versus undesirable behavior. It considered, or it goes to consider the average behavior as ideal and ignores the extreme and positive characteristics, such as geniuses, those who follow or falls above the normal age. Are they really abnormal? That's the question I've already asked. Number 3, personal discomfort. This criterion considers those who are not comfortable with their lives and considers them abnormal. That is, those who tend to seek treatment. In this case, those people tend to judge their own state as normal or abnormal, as the situation probably presents. This approach is probably the most widely used in the case of the less severe psychological disorders. Such people go for therapy not because other people have declared them abnormal, but because they are unable to cope with their way of life. Unfortunately, once again, this criterion has a weakness because a particular behavior may cause different degrees of not feeling satisfied or dissatisfied people. To that extent, it lacks objective standards and may become problematic, like in the case of behaviors that may cause serious harm and that which may be socially disruptive. For example, drug abuse and alcohol intake. And the question is, when one has taken alcohol, have taken their drugs, and behave outside the normal age, are they abnormal in that very instance, or are they okay? Once again, food for thought. Number 4, the other criterion we look into is maladaptive behavior. The level of maladaptiveness determines one's abnormality. For instance, does the individual's behavior pattern meet the demands of his or her life, such as, can he or she hold a job? Does he or she have a spouse? The question is society standards. Because like our society, at a certain age, there is the expectation that somebody needs to be married. There is the expectation somebody needs to have a job. But if they miss out, do we classify them as an abnormal? The other issue is, are they able to relate to others well? Do they pay their bills on time? And if they don't pay on time, are they okay? This criterion overlaps with the norm violation criterion we have discussed earlier, because many norms help us to adapt to societal requirements. It may be related to personal discomfort because the consequence of our behavior may make us feel uncomfortable and therefore go to seek for help. For instance, a person who can't hold a job due to continuous drinking may want to find a solution to his drinking. Maladaptive approach tend to concentrate on the practical matter of getting through life with some measure of success. Inability to cope with the demands of life imply a requirement of psychological help. Then number 5, deviation from the ideal. An individual who has failed to achieve certain ideals may be considered as maladjusted. For example, an individual may fail to hold a job, may fail to have a family or be in an intimate relationship. However, this may be closely related to the norm violation and therefore changes as the society ideals change. For example, in developed countries, foregoing having children is no longer an issue. And therefore, how may we define abnormal behavior? This is behavior that is deviant, maladaptive, or personally distressful. And in psychopathology, we look at two terms, the psych, the pathology, which forms the word psychopathology. A distress at the psychological level, at the mind level, an illness at the mind level. And this gives us our description. And the critical thing we need to understand is defiant maladaptive behavior, which is also personally distressful. So in this class, we will be looking at some areas of psychopathology. We will be going deeper, and as I have sent the notes within our interaction, like in the first week, I sent notes on definition of abnormal psychology and psychopathology. I have also sent notes to you on historical perspectives of psychopathology. Basically, this is about learning the history, the origin, what other societies have done with abnormal behavior with psychopathology, how they treated those who were perceived not okay. And in our society, we have even used the word mad to refer to mental disorders. But for the purposes of this class, we don't use madness, we use mental disorders or mental illness. I have also sent you a model of psychopathology. And this model emphasizes the biopsychosocial approach. And for the purposes of our class and for the local context, I would want to improve these and talk about the biopsychosocial spiritual approach. If I would probably borrow a little from the DSM-4 text, although discontinued, it gives us a wonderful background about understanding psychopathology. The DSM-4, Diagnostic Statistical Manual of the American Psychological Association, is used to give a guideline for making a diagnosis in a standardized form and for enhancing agreement among clinicians. There is an equivalent publication by the WHO called the ICD-10, International Classification of Diseases, Volume 10. And the DSM uses a multi-actual evaluation and is a holistic approach. And why I'm going back to a text we no longer use is to help us to understand in this class a little bit of the connection of the biopsychosocial spiritual approach into understanding psychopathology. And I always often tell my class, this aspect of the DSM-4 is very, very important because even as we shall be looking at the DSM-5, it helps us to give us a background. The DSM-4 has 5 axes. The first axis is about functional psychiatric problems. And I would want us to do a connection with the biological, the psychological, the social, the spiritual, so that we may understand this model very well. In axis 1, we look at the functional psychiatric problems. For example, schizophrenia, drug-induced psychosis, or major depression. And the question we ask here, do we have a biological concern? Is there a psychiatric concern? And it helps us to go to the first argument of the biology within the biopsychosocial approach. And we want to isolate. As we are going through, even as we are assessing this client of ours, even as we are assessing this person before us, we are asking ourselves, is there a clinical concern? And the clinical concern is where now the biological aspect comes in. And we want to look at, is there any functional psychiatric problem? So we want to isolate those serious psychiatric problems. Drug-induced psychosis, schizophrenia, major depression, or any other form of psychosis. And then we go to the axis number 2, and we want to ask, is there any mental retardation, specific developmental disorders, and personality disorders? For children, we talk of traits, not personality, until age 18. For example, with children, developmental disorder like speech delays, dyslexia. And the question is, how does mental retardation affect axis 1? A child who had dyslexia, a child who had developmental disorder, an adult who has a personality disorder. If this adult has an issue at axis 1, you can now see the complicity. Then we go to axis 2, the general medical conditions. For example, malaria and other diseases. And you have heard out there in our society that so-and-so had malaria, which was making him or her get mad. Malaria that was affecting him to developing a psychosis. So we are asking, is there a medical condition, a chronic condition, a medical condition that affects or meditates towards making the psychosis even much more serious? Because psychosis is progressive and can be affected from the biological causes. They could be the psychological causes, they could be the social issues, they could be the environmental issues, they could be the spiritual issues. So even as we assess our client, we are asking ourselves, what other issues revolve around this condition? Then at axis 4, we check for the psychosocial stressors which have direct links to axis 1. And the critical thing here we ask is, like in this time of COVID-19, those who have lost their jobs, those who have lost their businesses, those who have lost their families in times like this, how are they likely to behave at the mental level? Your job was your only fallback. And if this person has a chronic condition, if this person has a personality disorder, of course, ladies and gentlemen, we are saying the mental illness will be much more serious because of these other causative factors. As we do assessment, and this is something I want to emphasize so much, we need to keep on asking, and you have the notes with you. So read on the biopsychosocial approach, and tonight I added on the spiritual aspect. So we are asking, how does this complicate the other? And how does the other complicate the other one? I would not want to go to the axis 5, which is the global assessment of functioning, but maybe for the purposes of this class, although we don't use the global assessment of functioning now, I usually say, and if you be working or you'll be doing your practicum at Kenyatta National Hospital, you won't escape the aspect of DSM-4. Even though we are in DSM-5, which I will be sending to you one of these days, it may not be necessary for our exam because it's a heavy text, but for your future learning, I will see whether I can get the soft copy of the DSM-5. The global assessment of functioning This is rated from 0 to 100, and it is usually a determinant of prognosis or the cause of illness or the outcome of the disorder. Clinicians have used the global assessment of functioning to decide on whether somebody is fit to resume duty after a course of treatment for a mental condition, because it actually assesses, is this person well enough to go back to their duty? Are they improving okay? And even as we move and as we have moved to DSM-5, for the purposes of your own learning, for the purposes of your assessment, for the purposes of your practice, it is always good to draw back to DSM-4, and especially on the 5 axes. I will mention, as I probably prepare to sum up this class, the 4 P's of arriving at a medical diagnosis, and especially where psychopathology is involved. We look at the first P, the predisposing factors or predisposition. Is the person predisposed? And the question here we ask is there any genetic makeup, a disrupted childhood that could be predisposing this person to a mental illness? The second P is we check on the precipitating factors. What has precipitated the problem now? For example, the delivery of a new baby, a loss like the job losses we have experienced in this COVID-19 era and the challenges, and which could be a causative factor. Number 3, the perpetuating factors. What is making the condition continue? For example, poor housing. In a case of schizophrenia, we find that the issue of high emotion expressed within some families could be a causative factor. The perpetuating factors. Is this person having housing? Is this person having a supporting environment? And then finally, the protective factors. We all have protective factors which help us to survive. For example, one's intelligence, assertiveness, not keeping quiet. Basically, we also talk of handy personalities. Those people who can survive faster and easier than others. And for this class, ladies and gentlemen, these are some of the areas we'll be looking into to guide us into understanding mental conditions, understanding mental disorders. Within the notes too, I have sent you models of psychopathology, and one of them we looked into is actually the biopsychosocial model. I have alluded to other models, and some of them, very, very briefly in summary, the psychological aspects of abnormal behavior. And within the psychological aspects, we look at those theories that attribute disturbed or abnormal behavior purely to psychological processes that may result from the individual's interaction with their environment. For example, the individual may develop abnormal behavior due to cruel or negligent upbringing or exposure to excessive stress, traumatic experiences. These are many theories, or they exist several theories that proposes psychological explanations of abnormal behavior, and these theories can be grouped under the following broad school of thought. I will just mention them: the psychodynamic perspectives, the behavioral perspectives, and it will be your good work, ladies and gentlemen, to read beyond your teacher. And number 3, humanistic existential perspective. And number 4, the socio-cultural perspective. So within the psychological aspects, we have 4 areas: the psychodynamic perspective, the behavioral perspective, the humanistic extension perspective, and the socio-cultural perspective. From your theory class, we can read widely and connect. Then we have the historical perspectives, and these you'll find in some of the notes I have given you on the historical perspectives of psychopathology. What has been happening right from the Greek and scientific explanations, the supremacy of science as we developed, and all the way to the decline of the moral therapy. We shall be looking, as we move on, and maybe for the next class, into the classification of the mental disorders, the assessment of psychopathology, the treatment, and maybe I could also do a recording for the same, and I will be sending it to you. If there is any question, you can always reach me on my email. You can reach me on this WhatsApp group. You can put a question on the portal. Once again, I want to express my regret for not having been able to set up the class, but I'm trusting that tomorrow on Sunday, we shall meet online directly so that we can have a one-on-one. But for the time being, this is the class we would have had on yesterday, Friday, and it was not possible because of reasons beyond me. Ladies and gentlemen, continue enjoying this class and continue enjoying the interaction. Good night.